Welcome to another episode of Follow the Brand TV. I am your host, Grant McGaugh, CEO of 5-Star BDM, a 5-star personal brand and business development company. I want to take you on a journey through another deep dive into the world of personal branding and business development using compelling personal stories, business conversations, and tips to improve your brand. By listening to the Follow the Brand TV series, you will differentiate yourself from the competition and build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build confidence, and reflect who you are. Building your 5-star personal brand is a great way to improve your skills and knowledge. If you have any questions for me or any of my guests, please email me at grant.mcgaugh@5starbdm.com. Now, let's begin with our next episode on the Follow the Brand TV.
Five-Star BDM, Brand Development Masters, is a professional consulting and advisory group keenly focused on business development services for the small to mid-sized business and entrepreneurs. Although every business is unique, they often share business development challenges that can be addressed through smart branding. Services include process improvement and operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our business and personal branding company has helped a number of professionals and organizations to optimize and grow. This results in more business, more opportunities, better reach, positive outcomes. Visit www.5starbdm.com today to learn more.
In the United States, Black women face a stark reality. They are 3 times more likely to die from pregnancy-related causes than their white counterparts. This alarming statistic sets the stage for a critical conversation on maternal health equity, led by Dr. Alexandria Evans, a passionate advocate for systemic change. Dr. Alexandria Evans recalls her experiences in the emergency room, where she witnessed mothers seeking care in a system that failed them. I watched mothers walk into the ER, desperate for care, but they didn't belong there. These women needed stable housing, nutritious food, and genuine health care, not just temporary solutions. Recognizing that real change begins beyond hospital walls, Dr. Evans pursued a PhD in public health. She immersed herself in understanding the policies that shape lives and is founding a mission-driven firm to transform them. I knew then, real change doesn't start in hospitals. It starts in policy and systems. In leadership, she emphasized, Dr. Evans is not just conducting research, she is spearheading a movement. We must dismantle the systemic inequities that turn preventable deaths into tragedies. Her vision is to create solutions that empower communities, ensuring that maternal health equity becomes the norm, not the exception. Dr. Evans's work will involve advising healthcare leaders on policy reform, partnering with academic institutions for research-driven solutions, and shaping legislation like the Omnibus Act. Her efforts elevate the conversation on maternal health equity, one policy at a time, driving real systemic change. We can't fix what we refuse to see, Dr. Evans asserts. Her mission is clear: equity in action, leadership with vision. Join her on the Follow the Brand podcast, where she delves into the statistics, policy rooms, and communities fighting for change. Subscribe now and be part of the movement for a better future in maternal healthcare.
And what that did really is increase awareness, but also provided funding opportunities. So back to your previous question where you asked about what I would do, one of the things it did was open up funding for community-based interventions to really dig deep into the root of the issue and provide specific communities that experience the most disparities, more resources to combat poor maternal health outcomes.
Welcome, everybody, to the Final Brand Podcast. This is Grant McGaw, and I'm going to take it all the way out west. I love Vegas. Everybody knows things about Vegas. They go out there, they do a little gambling, they get out in the sun, lots of good shows out there, plenty to eat, but there is something else going on in the desert. And I found out a lot of what's going on from the people who live it, the people who live there. We're going to talk to Dr. Alexandria Evans. She recently graduated. She is a phenomenal person, and she brought to my attention because everyone knows I'm into healthcare. I love healthcare. I think it's a challenge for us to really hone in on healthcare from a human-centric perspective. She owns this space. We're going to have a candid conversation with her about why she chose this as a profession and what is her goal for her career as she moves forward. So, Alexandria, would you like to introduce yourself?
Yeah, hi. Thank you for having me. Hi, everyone. I'm Dr. Alexandria Evans. I live in Las Vegas. I've been out here for 18 years now. I am a recent graduate from the University of Nevada, Las Vegas. Go Rebels. And I got my doctorate in public health with a concentration in social and behavioral health. And I also hold a master's in public administration. So all things public administration, all things healthcare, all things health equity, that's right up my alley.
I love that. You know, you're right in my zone of genius, right? Right. So you're starting to share some of your personal journey. I want to know if you can share some of that journey and how your experiences in the emergency room shaped your passion for maternal health equity.
That was of all the jobs I've had, working in the ER was probably the most exciting. I've always loved healthcare. Since I was a kid, I was like, I want to be a doctor, but I've also loved policy. So working in the ER, I saw like a good mix. One thing that really frustrated me and just brought up a lot of emotion for myself working in the ER is just seeing all of the people that had no resources and then being forced to go to the ER to receive care. And it wasn't necessarily the best location or the best option for them. For example, if you because of EMTALA, that's the only place you can go if you don't have health insurance. So oftentimes I would see, families, women, young children in there simply because they couldn't get an appointment with their pediatrician or they had a quick question. And because our health system is so complicated, the quickest way that they could get care or to get an answer or to resolve whatever issue was to go to the ER. And while they deserve to have their needs met, it was the inappropriate place. And so at that time, I was like, I don't know if the ER and like being in going to medical school is the best route for me. I became more interested in policy and the systems that kind of force people into uncomfortable and unequitable situations. And so that's really what shifted my lens from ER to looking at policy and systemic change.
And seeing what's taking place, like what's causing that to happen. I understand that. Now we're getting to your zone of genius about what inspired you to pursue a PhD in public health. You've had this experience. Now you're telling us, hey, you pursue this PhD. You want to make a difference in healthcare policy and systemic reform. Can you talk to us more around those particular pursuits?
Yeah, ultimately, I decided to get a PhD because I don't think that change can really happen unless you have policies and systems that really uphold institutions and make them implement certain practices. And so I got my PhD because I wanted to work in a think tank, and there you get to use your brain in whatever way and come up with innovative and creative solutions. To address and meet the needs of the people in a real way. I also really enjoy community building and like talking with people. And so I felt that was a better way for me to really touch people, meet their needs, and come up with just ways that they can live just better lives, have better access. No one should have to struggle to just have their basic needs met.
This is important. I just want to double down on that just a little bit because there's some alarming statistics when it comes to maternal health and outcomes. And with, specifically women that are giving birth and specifically women of color that are giving birth, that the numbers just aren't very good. African Americans make up maybe 13, 14% of the population, but there's some stats out there that kind of alarm. Can you just tell us a little bit more about what you see as the big challenge in maternal health that you want to champion?
Yeah, so 80% of maternal deaths are actually preventable. So I think that's like the most alarming thing. Like these deaths should not be happening. People should not be having disparities in maternal health, and maternal and child health outcomes. So first, like that's the main point that I like to drive home. But the real root and the real cause is systemic inequities, racism. It really distributes and impacts the flow of resources. So for example, communities that have less resources, they are more likely to go to urban hospitals and urban facilities that perform worse on the maternal and child health indicators. They have higher C-sections, they have higher infant mortality rates. What else? Just the complications are insane. I mean, it doesn't have to be that way. I think also it's important to tap into implicit bias and knowing that not a lot of providers look like us. And so there's tons of stories. You can talk about Beyonce, Serena Williams, Shalon Irving, Tori Bowie. They've all passed away or have had issues while giving birth to their child because they didn't feel heard or respected by their care team. And so those are the real inequities, just on the surface level when you're actually in like labor and delivery and trying to access prenatal care. But deeper than that, the world that we live in right now is very interesting. Reproductive rights, women's health is under attack. Abortions are no longer legal in a lot of different places, and tied up and wrapped up in that is just reproductive health in general. And abortion and reproductive health is essential for a woman to be able to live a healthy life. Not only is it helpful for the woman, but they also have families, and so the family is also impacted. And so just looking at those systemic inequities, disparities in access to care, those are major flaws in our system that can be addressed if we really put our heads together and work more closely and not operate in silos and start from the top to bottom, from policy, working with community-based organizations, wrapping in practitioners, whether it's a pediatrician and OBGYN, high-risk health centers. There's just tons of opportunity. And so just bridging and bringing everyone together is the goal.
I have my PhD in biomedical informatics, and I tend to focus and get really passionate around genomics, particularly when we talk about genomics for precision health, genomics for community and population health, so on and so forth, and some of the disparities and differences that manifest themselves in the human body based on your heredity, your ethnicity, your environmental impact and stimulus that's coming from outside of your control, and how that impacts the way you ingest medicine, the way your body takes in that medicine and delivers it throughout your cells. Even though the drug is the same, the dosage is the same, the age, weight, blood pressure, all of these other vital signs may be the same, but the drug may manifest itself differently between these two demographics, just simply based on the differences in their genetic history and their genomes.
that is a great goal. You identified some of the, problems in the health equity landscape. I want to know this because now you've done your dissertation, you've gotten your academic accomplishments. You've graduated. If you were in a position of power, someone that could make change, what changes do you think would be practical that you would take on and you would make a change in the community?
Ooh, I actually really love that question. I have done some like fundraising and philanthropic work. So I think connecting funders to legislators in a real way, in a meaningful way, not just brief interactions, like brief meetings, but really getting them to understand the community. And then training up actual community members so that way we have providers that look like us serving those that are, in need of maternal health care. Developing like community-based interventions like that is something that I'm very, very, very much interested in. Whether it is increasing funding so that way we can have doulas assist and be present. They do improve like maternal and child health outcomes. So whether it's having doulas more present and having them increasing their funding and reimbursement rates for Medicare. That is something that I would do. Having more lactation consultants, just increasing the diversity in the workforce, I think it's extremely important. And then finding funding that supports those goals. And then kind of like making them a family. I feel like, again, a lot of times things operate in silos and everyone's competing for the same amount of money, but the goal is the same. So just building better relationships.
That's so important, building better relationships. I like how you just said that. You shared with me a couple of different people you look up to in the industry, and you said, that's who I want to be in the next 5 and 10 years, so that you have a platform that you can make change happen. So you're not just talking about these things. First of all, share with us, who are your mentors and why do you look up to them? And secondly, can you then elaborate on the role of policy and legislation like the Omnibus Act in driving systemic healthcare reform if you were in one of these positions of authority?
Yeah, so one of my a person that I look up to quite a bit is Monica McLemore. She is a brilliant researcher. She's also a nurse. She was in the Bay Area, and for some reason I want to say she's in Washington right now. I'm not 100% for sure. But I've been following her work for a very, very long time. Dr. Joy Creary as well. I cited her in my dissertation. And there's also tons of legislators like Lauren Underwood. She was part of the Omnibus Act. And essentially what that did, it recognized the maternal health crisis as being an actual crisis. The United States has one of the worst maternal health crises in the world, and we are an industrialized country. So that's very, very alarming. And what that did really is increase awareness, but also provided funding opportunities. So back to your previous question where you asked about what I would do, one of the things it did was open up funding for community-based interventions to really dig deep into the root of the issue and provide specific communities that experience the most disparities, more resources to combat poor maternal health outcomes.
Do you see that as a big problem now, given the current political landscape? Do you feel, this is how I feel, it's just not enough awareness and that people just don't know how monies are allocated and then the effect. What is the ultimate outcome or the root cause analysis as you would do like on a community? So, why are these people ending up in ER, let's just say, or why are these maternal deaths happening at such an alarming rate in a country like ours? Are we misappropriating our resources in a way? Because no matter how you want to look at it, it affects the whole community, right? Mm-hmm. No matter how you look at that, because the most expensive care you can get is in the ER. Mm-hmm. Yet it's the most expensive, and then it's the less effective, mm-hmm. because you could be there for things that aren't what you call critical. They're not urgent care. They're mm-hmm. just care, mm-hmm. and that's it. So my question to you is around, because you just graduated, you probably are in the know on a lot of these things. What advice would you give to other emerging leaders that are seeking this niche in healthcare advocacy?
Get connected with your community. They can tell you better than anything what it is that they need. And I think that's a common misconception and bad practice in most cases in research and the medical space. We tend to often assume and put what we want on people and the solutions that we want. But part of my dissertation actually was really doing a community-based approach to understanding how people utilize perinatal care, and the responses were interesting. So I did a survey, but my favorite part was doing interviews. And so I really spent about an hour with 10 different moms from a specific area here in West Las Vegas. And they shared with me what their experiences were. And a lot of times, it was the basic social determinants of health that prevented them from being able to access resources. So maybe they didn't have a car. They were struggling to even put food on the table. So if they have to pick between going to work and not getting paid for that day to go to a doctor's appointment where they're sitting in the waiting room for 3-4 hours to have a 10-minute visit, they're not going. Or if they have to take their child to a pediatric visit, they have to take the bus. And that in itself takes a long time. Now their child's dysregulated because they miss nap time, and it's a plethora of things. So the social determinants of health, and really understanding the social determinants of health and understanding the communities and what unique things impact them specifically. A lot of times, I would say nonprofits and organizations, it's blanket funding, and the ways that people are able to utilize those resources are very specific, and it doesn't maximize like the impact for the individual. And so for one example, I interviewed a lady, and she was actually from Jamaica, and she never got her driver's license out here. And so she had to take the bus. But one thing is, this is very unique, but she said, I just need to learn how to drive. Like, I can afford a car. I just need to learn how to drive. And so those little things, bus passes are here, for example, are something that are very helpful. If you have a driver's license, you can get a bus pass for 45 days. And it was just more convenient than going to just other nonprofit organizations to get just very like Band-Aid type solutions. So really speaking with the people that have done the work, that live it every day, they know what they need. And so touching base with them. And then also I would tell them to know your community so you know what resources are available. It should be a one-stop shop. People shouldn't have to go hunt and pick and scavenger to find what they need. They shouldn't have, it shouldn't be that much work. If we're a community and we want the best for everyone, we should make our resources and things known and available. I think that's a part of capacity building.
I always tell people I've never had a profession or a field. I've had a mission. And the reason I say that is that healthcare just is a vehicle to achieve my life mission. It is not who I have allegiance to. My allegiance is to all those people who are like my family, who for no reason but circumstance are good-natured individuals, loving, compassionate individuals who, for the absence of a possible opportunity, one different chance, one additional person to believe in them, could be in the seat that I'm sitting in right now. so I always tell people, you see me today, but I don't exist here. I exist in the future. And as long as I plan to do anything on this planet, I will exist in the future, because that's where excellence resides. And so every day and it also allows me to walk through the world each day in amazement, because this day was planned 5 years ago, 10 years ago. So all I'm doing each day is looking at excellence that I sought to achieve 5, 10 years ago.
I like that capacity building. You have a unique leadership style, and we worked together, for the last, 3 or 4 weeks, just building out and really focusing on what you want to accomplish, which has been phenomenal. I would like for you to share a little bit about your leadership style and how you want to utilize that style to position yourself for success.
That's a good question. I am very much I like to listen. I like to observe. I don't like to assume. One thing I've learned in my life is that you don't know everything. So I like to sit back and listen to others. I don't think that I'm the know-it-all. And so I like to surround myself with people that are able to fill in the gaps and are able to be the strengths where maybe I'm a little bit weaker. I think that makes us a well-rounded team. So I like to surround myself with other brilliant minds to help just develop and have just meaningful conversations, to challenge me, to push each other. There is no one single solution. And so one mind isn't going to get the job done. And so that is how I like to lead. I like to listen. I like to support. I also people are not, we're so complex. We have our own personal lives too. And this is actually very challenging work. I find myself kind of down sometimes because the statistics aren't the best. And when you see people struggling, it doesn't feel good. So also just using a lens that you also have to take care of yourself. You can't, if you're not, if your cup isn't full, you can't help anybody else. You can't pour from an empty cup. So I really like to surround myself with other strong individuals. I like to surround myself with people that know more than me, that can teach me, that can help me grow as well. We're a team, we're a unit. And that's how I like to lead in a very balanced space.
Very good, very good. And you are very balanced. One of the things that I always pride myself when I'm working with individuals, I want to walk in their shoes. And you allowed me to walk a little bit in your shoes. I said, take me back in time 5 years ago, what you were doing, maybe even 10 years ago, as you went across your academic path, and how your awareness has changed and how you've looked at different things, and you begin to see a world that at one point you have, certain viewpoints. Everybody has a certain viewpoint, as you alluded to. But as you begin to go deeper into it, that vision changes. And it changes over time with more information and the more stories about what you're really trying to accomplish with your skill set. Mm-hmm. So you have a skill set, you have a tool set, you have a very good, your mindset is what's going to help you to traverse forward. I want you to help and talk to that student right now who's a rebel, right? Maybe this is their first year and they're coming on campus and maybe they've gone through their first semester. What advice would you give to them if they were on a similar coursework as yourself?
Find a mentor. Literally look up what professors, it doesn't have to be in your exact school. For example, I was in the School of Public Health, look at sociology, look at public policy, look anywhere, but someone that has similar interests as you and ask them to mentor you. They're more than happy to bring you on and to help you learn and to help you grow. I think it's always important to have like 2 to 3 mentors, one that has done exactly what it is that you aspire to accomplish, one that has a similar goal but has taken a bit of a different route. And that way you're able to have like-minded people supporting you, but you're able to have all of your options available. If you're just starting out, there's no limits. There's no limits. So just don't limit yourself. Be as open, ask questions, talk to people. Don't be shy. That's my advice.
I love that. Don't be shy. Go ahead and go for it. You don't have much to lose, except you don't live your full potential. That's the thing. I want you to talk to the audience a little bit about before you met me and when you went through the program, through the brand blueprint strategy, and what you feel you got the most out of at this point to help others.
Before I met you, big picture, knew what I wanted to do, but what that actually looked like the how, I had no idea. And it was a bit overwhelming, especially fresh out of graduation. I'm like, I have to have my life figured out right now. And so I just had a lot of pressure on myself. But working with you, you helped me conceptualize the things that had been in my head, and it helped me put it to paper. So now I feel like I have a solid foundation and a framework to succeed. When it was in my head, it didn't feel digestible. I didn't know the steps. It didn't feel as doable. And now I'm like, okay, I can do this. There's a plan. I can move forward and I can move forward confidently. So it helped me understand my career goals better. It helped me articulate my career goals better. And it also helped me understand myself better.
I like working with you as we went through this because I saw the confidence building, the aha moments, and how to put together disparate parts of your career trajectory so that it's more unified, there's more clarity in everything. And then now, as you stated, you have a physical blueprint that you can look at, and then you can hold yourself accountable. Like I said, if I haven't accomplished a certain, task or wherever it may be in a certain period of time, I have to only look at myself like, what did I do? Or what didn't I do? Or then what did I learn out of this? As we went through the entire framework. And I love the fact that you really understood this one particular point, was relationships. You've got to have the right relationships. It's not about having thousands of followers and thousands of connections. You need 25 to 50 of the right connections. People that really believe in you, as you started alluding to earlier about mentorships, and people that advocate for you. Someone that says, hey, we've got a particular issue or a problem. Who can we bring into this equation that's going to help solve it? Also, you want your name to come up, Dr. Alexandria Evans. You're like, whoa, who is she? And they're like, and then you've got your whole way of telling that story that's authentic. It's about being authentic. And that's another thing I got from working with you as we got through this, is that we weren't building a personal brand for you that was outside of yourself. It was just filling in the clarity and the vividness of who you are as an individual as you move forward, and you can speak confidently to anyone else about what it is that you want to accomplish. I really, really like that about you. And I want you to continue on that journey for sure. What parting words would you leave with our audience that you feel that, you know what, I want to make sure I tell this part of the story because it means so much to you?
I would say it's unrelated to maternal health, but always use your voice, be an advocate. We're here to make the world a better place, to leave it better than what we found it. And you can't do so if you don't use your voice and know yourself, know your core values and your core beliefs. So really getting in touch with yourself and using your voice to go forth and go out into the world and just make it so much better than the way you found it.
I love that. Great statement. Great statement. You are on your way. Watch out, Las Vegas. We got a new player in town. She's going to make some major, major changes in what you do. The audience needs to know how to contact you. So what is the best way?
My email or LinkedIn. My email is alexandriaevans@gmail.com. And then you can also find me on LinkedIn, Alexandria Evans. I think it's PhD and PA. I could, if possible, drop the link somewhere, somehow. But yeah, that's where you can find me. That's where I'm.
Well, we'll definitely have it in the show notes. You've done a wonderful job. Love working with you. Love your mission. Anything I can do going forward to help you, I would certainly, never hesitate to reach out, especially your fellow rebels. They was like, hey, I see what Dr. Alexandria Evans is the track that she's on. How do I get on that track? And I say, hey, go to 5-star BDM. That's the number 5. That star is B for brand, D for development, and for masters.com. You can view all the episodes and follow brand there. You'll pick up the golden nuggets of how you can begin to build out your own personal brand for career development and business development going forward. So I want to thank you again for being on the show.
Thank you for having me. I appreciate it.
You're welcome.
Man, who's your favorite podcaster? Man, Grant, man. I love Grant's podcast. Well, who's Grant? I'm going to send you the link. I love Grant.
I love the interview. I've done a lot of these, and this is a great one. It's always great to talk to people who know what they're doing, and it's clear you're a great host, and you've done this many times before.
I feel great that we're having this conversation here. Met a new person in business who I previously didn't know.
It was an amazing podcast. Grant is an amazing interviewer. I learned a lot.
I really enjoyed this. Great questions, great talk track. Super appreciate you having me on. It's been a very fun episode to talk about a lot of things that I don't always get to dive into. So this has been a fantastic conversation.
I wouldn't be where I am here today, of course, not on this stage. However, not in my current business projection and my current business model without working with you.
Follow the Brand TV broadcast host, Grant McGaw, as he visits with top executives and entrepreneurs to find out their secrets of success with their personal brand. Follow the Brand TV broadcast host as he focuses on brand development to build better relationships, bring value to your business, relationships, and career. You will enjoy listening to each episode that is tailored to speak to you directly. If you're looking for this type of clarity in terms of building your brand, you have tuned into the right station. Each episode will help you to shape a conversation in the 5-star BDM network of 20,000 professionals and become a springboard for your corporate engagement and business opportunities. Each guest will frame their story in the areas of personal branding, business development, career development, financial empowerment, and technology innovation. Grant McGaw explains why he is the CEO and owner of his own professional career. Grant is an accomplished business leader and entrepreneur who wants to give back to individuals to grow their personal brand strategy. Tune in as he weaves his story about new possibilities, while to you exceed expectations. If you love storytelling, this show will make for fun.
I am Grant McGaw, CEO of 5-Star BDM and host of the award-winning Follow Brand podcast and TV series. Today, I am talking about defining your brand, defining your future, a 30-day challenge for specifically healthcare professionals. So let me start with a simple but powerful question. When people hear your name in the healthcare world, what do they think? Do they think innovation, leadership, compassion, or are you just another name on a crowded list? Today, I want to talk to you about something that often gets overlooked, your personal brand. You might be thinking, is it personal branding for social media influencers or celebrities? Absolutely not. Your personal brand is your professional reputation. It is your story, your impact, your mark on the healthcare world. And if you are not defining it, then someone else is defining it for you. This is why your brand matters now more than ever. Let me share a story with you. I recently worked with a very talented clinical professional, one of my clients named Sheila. And Sheila, she was exceptional in her field. She was known for patient care, clinical skills, and her innovative healthcare approach, but somehow she found herself stuck, overlooked for promotion, not invited to speak at industry events, and her ideas weren't gaining traction. Why? Because her personal brand was nearly invisible. She hadn't taken the time to tell her story, to position herself as a thought leader, or to showcase her expertise beyond the walls of her clinic. The question is, are you being overlooked? If you are feeling like Sheila, capable, passionate, yet not recognized, you are not alone. Many healthcare professionals experience this, especially in a field that's more competitive than ever. But here's the good news. It doesn't have to be this way. I'm excited to introduce our 30-day personal branding challenge, a step-by-step journey designed specifically for healthcare professionals like you. This challenge will help you define your brand, clarify your message, and amplify your impact. And by the end of it, you will have a clear, actionable blueprint for success that positions you as a leader in your field. So why is personal branding so critical right now? Because the healthcare landscape is shifting under our feet. Let me share just a few trends with you in telemedicine, digital health platforms that are on the rise. Your digital presence is becoming as important as your physical presence. There is a growing emphasis on patient experience and satisfaction. Patients are choosing providers who resonate with them on a personal level. The need for interdisciplinary collaboration is increasing, and professionals who are recognized as leaders are more likely to be at the forefront of these collaborations. Your personal brand is what connects you to these opportunities. It is what makes your voice stand out in a crowded digital space, attracts patients to your practice, and positions you as a leader in collaborative healthcare environments. So let's talk about day one of the challenge, defining your brand identity. Why do we start here? Because if you do not have a clear vision, you are wandering aimlessly. Your brand identity is your North Star. It guides your every decision, your every conversation, every opportunity you pursue. And on day one, we will ask you to reflect on your core values in healthcare. What drives you? Is it compassion, innovation, integrity? Write down at least 3 values that define you. Then identify your key strengths, the skills that set you apart, like patient communication, leadership in crisis, or technology integration. Next, we will define your target audience. Who are you speaking to? Your peers, patients, or healthcare leadership? You will create a detailed persona for each group to ensure your message resonates effectively. We will guide you through crafting a personal mission statement. And what is that? It is a 50 to 100 word declaration of who you are, what you do, and why it matters. Here is my personal mission statement. I am Grant McGaw, a leader in business development, branding, and healthcare strategy. And as the founder of 5-Star BDM, I empower professionals and organizations to elevate their presence, drive growth, and lead with purpose. I combine innovation, technology, and strategic insights to help others build powerful, professional, personal brands and create lasting legacies. With a passion for connecting people and inspiring change, I dedicate myself to fostering excellence, driving transformation, and shaping the future of healthcare and business leadership. This is the heartbeat of my brand. Let's take a moment for a quick interactive exercise. I want each of you to share one core value that defines you in your professional life. It could be empathy, innovation, or patient advocacy. By doing this, one thing, you are becoming intentional in manifesting your personal brand. You've already taken the first step. You're starting to think about what makes you unique. And that's exactly what this challenge is all about. Before we dive deeper, let's talk about some common branding mistakes healthcare professionals make. And that is being inconsistent across social media platforms. Your LinkedIn should match your personal website and your social media. And neglecting to highlight your unique skills or experiences far too often occurs. And failing to engage with industry conversations online is a key mistake. You have insights that matter. Share them. And these mistakes are easy to fix. And the 30-day challenge will guide you in making sure you avoid them. Now, let me introduce you to Keith. Now, Keith worked with me. He's a healthcare professional who completed our challenge about 3 or 4 months ago. And he felt stuck in his role. And he was unable to move up the leadership ladder. He was great at what he did, but was constantly overshadowed by others. So Keith took on the 30-day challenge. He defined his brand identity. He optimized his LinkedIn profile. He started to engage in online healthcare communities and even published a few thought leadership articles. Now, today, Keith has been promoted to a regional director position, and he attributes much of his success to the visibility and credibility his personal brand has given him. Now, this challenge helped him to understand the power of his own voice. He gained confidence, recognition, and career growth he had been seeking for years. So what are the long-term benefits of building a strong personal brand? How about enhanced career resilience in a rapidly changing industry, or increased ability to influence healthcare policy and practices? Greater opportunities for leadership roles and mentorship. Now, here are 3 things you can do right now, even before starting the challenge. You can audit your own online presence. You can Google yourself. You can check your LinkedIn and see what others are seeing. I strongly suggest you update your professional website, your headshot, and your bio to make sure that they are reflecting who you are today. And start engaging in online conversations. Join many of the LinkedIn groups that resonate with you and comment on articles and share your thoughts. So I want to take you through each week so you can understand exactly what you are committing to and why it matters and the value you'll gain in each step. Week 1 is all about building your foundation. We start by defining your brand identity, which, as I mentioned earlier, is your North Star. Now, that week, you will work on reflecting on your core values, identifying your unique strengths, and determining your target audience, the people you want to influence, serve, or connect with. But it does not stop there. You'll also will be able to create a personal mission statement that shows who you are and what you stand for in healthcare. And why is that important? Because a clear mission statement acts like a magnet. It attracts the right opportunities, people, and conversations to you. You'll complete a brand essence worksheet and draft your 30-second elevator pitch, a tool that will allow you to confidently communicate your value anytime, anywhere. Now, week 2 is all about content creation and positioning yourself as a thought leader. And now that you have this solid foundation, it's time to make some noise. You'll start by creating a content strategy that aligns with your brand vision. This includes developing a blog series or recording a podcast episode or designing a presentation that showcases your expertise. And why is that important? Because in today's digital age, content is king. The more you value, the more you provide content, the more people recognize you as a trusted authority in your field. You will also learn to engage effectively on platforms like LinkedIn, connecting with peers and participating in industry discussions and sharing insights that demonstrate your expertise. So then we move to week 3, which has a clear focus on networking and collaboration. This is where your brand starts to extend beyond yourself and connect with the broader healthcare community. You will attend virtual healthcare conferences and participate in Facebook or Instagram chats or join some LinkedIn groups and even collaborate on guest posts and their webinars with other healthcare professionals. And why is this valuable? Because your personal branding isn't just about visibility. It is about relationships. And by building a network of like-minded professionals, you position yourself at the center of your field. You'll be known as someone who is not only knowledgeable, but also approachable, collaborative, and influential. Now, in week 4, this is where we amplify your brand and measure your impact. You will create a personal brand video that brings together your entire journey and showcases your healthcare expertise. And you'll learn to develop a lead magnet to attract potential clients or collaborators and optimize your online presence with SEO strategies to ensure that you're seen by the right people. And why is this crucial? Because amplification without measurement is like driving with your eyes closed. And you need to know what's working and what is not. Now, you'll learn how to analyze your engagement. You'll adjust your strategy accordingly and keep refining your brand to maintain momentum. So, what do you gain from this challenge? Again, in week 1, we're going to give you clarity. You're going to get a clear understanding of your brand vision, message, and audience. And in week 2, we're going to build your visibility by positioning you as a thought leader through strategic content. In week 3, we strengthen your influence and connections and by engaging and collaborating with your professional community. And in week 4, we amplify your brand and this will definitely help you to measure its impact and ensure your efforts are not only effective, but also sustainable in the long run. So now it is your turn. Are you ready to step up and be recognized for the incredible professional you are? To define your brand, to clarify your message, and start making the impact you were born to make. So now that you know what the 30-day personal branding challenge entails and the incredible value it can bring, you might be asking, how do I get started? How do I access this content and become part of a thriving community of like-minded professionals? Let me walk you through the simple steps to join this transformative journey. And in step 1, sign up on our website. You head over to 5-star BDM, that's B for brand, D for development, M for masters.com, and look for the 30-day personal branding challenge banner on the homepage. Go ahead and click on it, and you will be guided to a registration page. It only takes a few minutes to sign up. And it's absolutely free. Step 2, access daily content once you have registered. You will receive an email every morning with your daily challenge. And that includes a video tutorial from me guiding you through each step. You will get access to a checklist, worksheets, and practical exercises designed to help you build your brand one day at a time. And in step 3, you'll join the 5-star BDM community. By joining the challenge, you automatically become a member of our vibrant 5-star BDM community of over 20,000 professionals. And you'll gain exclusive access to our private online group where you can connect with peers, share your progress, ask questions, and get feedback in real time. Now you'll find support, you'll find the inspiration, and maybe a few mentors along the way. And in step 4, engage and share your journey as part of the community. You can participate in live Q&A sessions, exclusive webinars, and networking events. And you'll also have the opportunity to share your brand journey and celebrate your wins and learn from others' experiences. The more you engage, the more you grow, and the more we all grow together. And in step 5, download your resources. And if you need a quick reference or you need an actionable guide, it's right here. I want you to download the comprehensive checklist and resources from the website. So you have everything you need at your fingertips to stay on track and succeed. So by joining this challenge, you're not just signing up for the 30 days of content. You're becoming part of a dynamic community of healthcare leaders committed to growth, impact, and innovation. You'll gain insights, form connections, and unlock opportunities that could potentially change the course of your career. So join us today at 5starbdm.com. Be a part of something bigger. So, are you ready to step up and start building the brand that truly represents who you are? Are you ready to connect with a community of 20,000 like-minded professionals who are just as committed to excellence as you are? Don't wait another day. Go to 5starbdm.com right now, sign up for the 30-day challenge, and take the first step toward transforming your professional future. Let's do this together. Let's make your brand a powerful force for change in healthcare. I will see you inside the challenge. Join the 30-day challenge today. Thank you so much. Tune in for our next show or click on our website at www.5starbdm/followthebrandtv. Thank you.